In our continuing series of reports about Asia, we'll investigate the Philippine medical system. The Philippines has a special phenomenon where private doctors operate within a hospital and they are not staff of the hospital. This means they receive no salary and most rent hospital or clinic space. Some say such commercialization of the medical services can lead to ethical problems. Follow our report as we learn more.
In the Philippines, medical care is a luxury for many people.
Last time I went to the hospital, maybe 3 years ago.
The Philippines has more than 7,000 islands, with a small island such as Olango having only one hospital. It is relatively expensive for the local population to see a doctor. Typically, it is only done as a last resort. Many may simply go directly to the pharmacy to buy medicine.
This whole island only has a public hospital and one doctor to take care of more than 15,000 residents. The hospital doesn't even have surgical equipment.
Some people who cannot go to city, and then they will just go home, and then later on, some of them died.
In Taiwan, residents are blessed with good healthcare services. In the Philippines, however, many people who are sick still can't access medical treatment.
There are a lot of medicines that may not be covered by PhilHealth. But one improvement recently is that most cancer medications are already partly shouldered by PhilHealth.
Because one has health insurance doesn't mean that the needs of the people can be met. In fact, in the Philippines, the medical profession has become quite commercialized.
The extent of commercialization of the Philippines can be seen as this large hospital resembles a shopping mall, where many doctors rent or purchase individual clinics. There's no need to pre-register, as one can simply line up to see a doctor.
Amount is, it ranges from 30,000, I think.
30,000.
And above. Depends on the number of doctors in the room.
This hospital corridor is similar to a busy street with more than 1,000 doctors. Each has set up like an individual business. They are not hospital staff and don't receive salaries from the hospital. To see a doctor, one just lines up with no need to take a number.
There's no rule, there's no policy. Right.
At the same hospital, when treating the same disease, one may be charged differently. This is accepted and doesn't come as a surprise.
Of course, they may charge, for example, 400 pesos.
According to Dr. Cuenca, for a minor illness, doctors' fees are generally about $10 US, with his fees between $8 to $15 US, and some doctors charging as much as $18 US. This doesn't include the cost of medicine along with exam and other miscellaneous expenses.
We have that also for the visual inspection with acetic acid, or the VIA, okay? And, but not for ultrasound, because ultrasound is a specialized procedure.
In the Philippines, the current day wage is 500 pesos, or the equivalent of $10 US. Therefore, to see a doctor could cost a person 1 to 2 days of wages. So what do poor people do when they are in an emergency situation? Actually, they go to cheaper public hospitals which are overcrowded. However, such a difficult circumstance leads many to simply give up on seeing a doctor. This is a dialysis center established at the Metropolitan Medical Center by a Taiwanese person. Nian Caixin says that outsourcing such medical services in the Philippines is very common, and they were one of the first to enter this market and seize this opportunity.
I believe that we are one of the first Taiwanese company to provide medical service in Southeast Asia.
Dialysis machines run day and night as 30 patients can be treated in one day. PhilHealth covers 90 dialysis treatments a year, which means coverage for 8 months. With a population in the hundreds of millions, some believe that there are many more than the reported 30,000 people in the Philippines which need dialysis.
The country's economy is improving, and if health insurance improves, more patients will have the opportunity to undergo dialysis.
This is a story about future vision or selling shoes to Africans, as one should not look at the past but to the future. Caixin is bravely entering the Philippines market and utilizing his Taiwan experience.
第一个是医疗制度。
The first thing one needs to understand is the healthcare system and differences related to medical insurance in the Philippines.
In any case, going into business or the medical community in the Philippines is much different than Taiwan. When we put our trust in the hands of doctors, they must also be properly aware of the true value of human life.
Now, however, there are doctors who just like to earn money. They just go to private hospital. They don't have to go to university. It's a little simple life. Measurement of doctor success is not only getting money. You must remember that. It is also service to the community.
Perhaps this is the answer that we are looking for between the delicate balance of healthcare for the community.